All right, let's jump right into this explainer. Today, we're taking a deep dive into the absolute architectural marvel that is the human body. Specifically, we're looking at the blueprint for the upper limb and the thorax. But, we aren't just going to look at when things go right. We're also going to explore the glitches. What happens when this incredibly complex machinery goes, well, a little off script. Because honestly, sometimes seeing how things break down is literally the best way to understand how they were built in the first place. Now, to kick things off, I've got a bit of an anatomical mystery for you. Have you ever actually stopped to watch a newborn baby sleep? If you have, you've probably noticed that their little bellies rise and fall with every single breath, but their chest, it barely moves at all. As adults, we breathe mostly by expanding our chest cavity. So what's going on there? Why is there such a massive shift in how we physically breathe? Well, stick with me, because as we map out the thorax today, we are going to completely uncover the structural reasons behind this. Okay, here's our roadmap for this explainer. 1. The human blueprint. 2. The thoracic cage. 3. The breathing border wall. 4. Upper limb wires. 5. Heart and glitches. And finally, number 6, windpipe and food pipe. Let's get to it. Section 1, the human blueprint. Basically, the golden rule in anatomy is that form always follows function. You can see this golden rule perfectly when you just look at our arms versus our legs. The upper limb is built for something anatomists call prehension. That's just a fancy word for intricate grasping and manipulation. To get that crazy fine motor control, the bones are smaller, they're relatively weaker, and the joints are a lot less stable to give us a massive range of motion. But then look at the lower limb. That is our biological landing gear. It's built entirely for locomotion and carrying our body weight. So naturally, the bones have to be much larger, the joints are incredibly stable, and the anti-gravity muscles are super developed. Form follows function. Moving on to section 2, the thoracic cage. This is our core protective enclosure. Now, what's really interesting about this CT scan of an adult thorax is the geometry. Do you see how it's kind of kidney-shaped? The width from side to side is actually wider than the depth from front to back. And the reason for this shape is that our ribs are angled obliquely downwards in adulthood. This specific design is what allows our chest to expand out and up, which creates the negative pressure we desperately need to pull air into our lungs. And here is the answer to our baby breathing mystery. So unlike that kidney-shaped adult chest, a baby's thorax under the age of 2 is perfectly circular. Their ribs are sitting completely horizontally. Now, because a circle already gives you the maximum area for its circumference, a baby physically cannot expand the width of their chest to breathe. Their rib cage is essentially locked in its maximum outward state. So, how do they get air? They have to rely entirely on their diaphragm pushing down into the abdomen. It is purely abdominal breathing. Mystery solved. Section 3, the breathing border wall. Let's talk a bit more about the diaphragm. The diaphragm is wild, guys. It doesn't just magically appear in the middle of your torso. It has a super complex origin story. It actually pieces itself together from 4 totally distinct embryonic structures: the septum transversum, the pleural peritoneal membranes, the dorsal mesentery of the esophagus, and the body wall. But here's the craziest part. The muscle of the diaphragm actually starts developing way up in your neck, specifically at the cervical levels C3, C4, and C5. And as the fetus grows, it drops down to its final spot, literally dragging its power cord, the phrenic nerve, all the way down the body with it. But a border wall is pretty useless if vital supplies can't get through. So the diaphragm has 3 highly regulated anatomical checkpoints. At the T8 vertebra, there's a quadrangular opening that lets the vena cava return deoxygenated blood. Go down a bit to T10, and you've got an oval gap for the esophagus. And finally, right against the spine at T12, there's a massive circular opening letting the descending aorta pump blood to your lower body. Of course, having holes in your border wall sets the stage for a first major anatomical glitch. What we're looking at here is an acquired sliding hiatal hernia. Remember that T10 opening for the esophagus I just mentioned? Well, sometimes that gap gets a little too wide, or the connective tissue around it gets weak. And when that happens, the upper part of the stomach literally slides right up through the diaphragm and herniates into the chest cavity. No surprise, this totally messes up the sphincter mechanism and leads to absolutely brutal acid reflux. Section 4, upper limb wires. Let's switch gears and look at the electrical system powering our arms. The arm gets its power from a massive network of nerves called the brachial plexus. And where this wiring gets damaged dictates the exact kind of physical glitch you get. If the upper nerve roots tear, like from a really bad fall onto your shoulder, you get Erb's paralysis. The arm just hangs by the side, rotated inward, in what's known as a waiter's tip deformity. But if the lower nerve roots are violently pulled, say you grab a tree branch to stop a fall, you end up with Klumpsky's paralysis. This wrecks the fine motor control of the hand, creating a severe claw-hand deformity. Plus, since those lower nerves also carry fibers to the head, a patient might even show up with a drooping eyelid and a constricted pupil, which is known as Horner syndrome. Section 5. Heart and glitches. Now we are getting into the cardiovascular plumbing. The development of our central chest is so intricate that sometimes you see really extreme developmental glitches, like Thoracopagus Twins. This is a very rare anomaly where conjoined twins are fused at the thorax and often actually share a single heart. It really highlights how incredibly complex this area is. Let's look closely at some other critical vascular glitches. Picture this fascinating clinical case right out of the text. A mother brings her 12-year-old son into the clinic. He's feeling weak after just minor exertion. He gets leg cramps when he walks, and he's short of breath. The doctor takes his blood pressure, and in his arms it is incredibly high, 126/20. But in his legs, dangerously low, just 80/60. And to make things even weirder, his x-rays show that the lower edges of his ribs look like they've been eroded or notched out. What in the world is splitting his circulatory system like this? So the crucial point here is that this boy has a congenital glitch called coarctation of the aorta. The aorta is the massive main pipe leaving your heart. In this condition, the arch of the aorta is physically pinched, usually right after the arteries that branch off to feed the arms. It's exactly like a kink in a garden hose. Before the kink, so the blood going to the upper body, pressure builds up massively. But after the kink, where blood is trying to reach the legs, there's barely a trickle, which causes all that weakness and cramping. Oh, and that rib notching? That's actually caused by smaller intercostal arteries swelling up to try and bypass the blockage. Here's another incredible vascular glitch, patent ductus arteriosus. When a baby is in the womb, they aren't breathing air, right? So their blood needs a way to completely bypass the lungs. The body does this using a short, wide channel that connects the pulmonary trunk straight to the aorta. Normally, 4 to 12 weeks after birth, this channel seals itself shut for good. But if it stays open, if it remains patent, you get oxygenated and deoxygenated blood mixing. This forces the heart to work on absolute overdrive and can cause serious heart failure if a surgeon doesn't fix it. Finally, Section 6, windpipe and food pipe. Let's take a look at the extremely tight real estate in our neck and chest. So your trachea, your windpipe, sits directly in front of your esophagus. It obviously has to stay open all the time so we can breathe, which is why it's reinforced by 16 to 20 rings of hard hyaline cartilage. But they aren't actually full circles. They're shapes like a C, and this brilliantly illustrates just how elegant our anatomical blueprint is. The back of the trachea, the open part of the C, is bridged only by a flexible band of smooth muscle. Because the esophagus sits right behind that gap, when you swallow a massive bite of food, the esophagus can physically bulge forward into that soft muscular space. It lets food pass right by without getting jammed against rigid cartilage. But, of course, being that close together comes with some serious risks. During fetal development, the breathing tube and the food tube actually start out as one single channel that has to perfectly split into two. If that separation process fails, you end up with a tracheoesophageal fistula. Basically, an abnormal connection is left between the esophagus and the trachea. This is absolutely terrifying for a newborn because anything they swallow, milk, water, saliva, can bypass the stomach and pour directly through that fistula right into their lungs, causing severe choking and pneumonia. It requires immediate emergency surgery. Which brings us to our final thought for this explainer. We've seen today just how beautifully and intricately our bodies are designed, from the shock-absorbing curve of our ribs to the expanding muscle of our windpipe. But we've also looked at the hernias, the paralyzed nerves, and the fistulas that happen when the blueprint goes awry. It really makes you wonder, are these clinical glitches simply random biological errors, or are they the exact clues we need to truly understand the complex, fragile, and honestly awe-inspiring evolutionary assembly of the human machine? Keep exploring the wonders of anatomy, everyone, because there is always another layer of the blueprint waiting to be uncovered.